Welcome to the first episode of Emergency Room Triage. How does it work? By Hey, It's Not Lupus. This will help explain why you might be waiting in the waiting room. ESI stands for Emergency Severity Index. It's how we decide how sick people are, or how fucked are you. ESI level 1 is pretty damn fucked. You're not walking through the front doors. An ambulance is bringing you, or we're dragging you out of a car. Either too much heroin, or a heart attack out in the field, or a stroke, or trauma 1. These are all things that are requiring us to give immediate attention to. Anybody else would have to wait. ESI 2. Highly likely you will be fucked very soon. This includes chest pain with diaphoresis, dizziness, shortness of breath, maybe some nausea and vomiting. Hypertensive crisis usually involves a headache, maybe some dizziness or some double vision, very high blood pressure. Shortness of breath. This is when someone can't catch their breath, can't take a walk because they can't breathe. Their pulse ox is usually a little low. They're probably going to need either a treatment or, in the worst case scenario, intubation. These people can walk in, but they cannot wait in the waiting room for very long. ESI 3. You need attention, but you can wait. Abdominal pain. This usually includes nausea, vomiting, diarrhea. A lot of times these people walk in eating. We have to tell you to stop eating and drinking. That's because if you eat and drink, it'll make you throw up when you're already throwing up. Vaginal bleeding, itching, discharge. You do need to be seen, but you can wait. My vajayjay burns. ESI level 4. You won't be any worse off if you were waiting an entire day. You could have went to your doctor in most cases. These are things like sore throat. My throat has been hurting for 30 minutes. Ankle pain. I'm too old to play football. Afebrile and happy, healthy babies with moms and dads that might just be a little nervous. She coughed one time. Eee. The last level on the ESI index is level 5, which is pretty much get the fuck out of here. Sketchy prescription refills. I ran out of Adderall. Forget it. It ain't happening. We don't give that out in the ER. Maybe someone that wants to get a pregnancy test. Please go to the dollar store. Do not waste your time in the emergency room. And don't complain when we make you wait because there are people dying. Remember the guy that came in with the stroke or the heart attack? STD checks. Somebody that comes in with absolutely zero symptoms, but they just want to get checked for AIDS, HIV, herpes, etc., etc. No. You need to go to a clinic for that. And besides, we don't even test for HIV in an emergency room. We can only test for things that there are symptoms for. So don't come here for that. This concludes your first episode of Emergency Room Triage. How does it work?